In this video, I'll explain 12 alarming signs and symptoms of diabetes that you absolutely shouldn't ignore. Diabetes is a silent killer, slowly wreaking havoc on your body, and the early symptoms often go unnoticed. Ignoring these warning signs could be a dangerous gamble, leading to life-threatening complications down the road. Catch it early, and you could save yourself from a lifetime of damage. I've seen many great videos, including those by Michigan Foot Doctors and Violin MD, that discuss diabetes symptoms, but I wanted to take it further. In this one, I won't just list the signs, I'll explain why they happen, what they might mean, and which ones are less talked about but equally important. Some of these symptoms might surprise you, especially if you've only heard about the common ones. My goal is to help you catch these red flags early, before diabetes leads to irreversible damage. Hello, and welcome to the Data Dan Explains channel. Before we get started, I have to be clear, I'm not a medical doctor. But this video is based on my conversations with real diabetic patients, so you should take the information shared here for educational purposes only, and do consult with your doctor for proper medical advice. Now let's get started on the 12 alarming signs and symptoms of diabetes you need to be aware of. 1. Frequent urination or polyuria. One of the earliest and most noticeable signs of diabetes is frequent urination. You might find yourself going to the bathroom far more often than usual, especially at night. This happens because when your blood sugar levels are too high, your kidneys try to filter out the excess glucose. But glucose pulls water with it, so instead of reabsorbing that water, your body flushes it out. This leads to more urine production. It's not just an inconvenience, it's your body working overtime to manage high blood sugar. If you find yourself waking up multiple times a night just to pee, it could be an early red flag of diabetes. 2. Excessive thirst or polydipsia. Feeling constantly thirsty, even after drinking plenty of fluids, is another strong warning sign of diabetes. This excessive thirst is directly linked to frequent urination. As your body loses more water through urination in an attempt to flush out excess glucose, it becomes dehydrated. In response, you feel an intense need to drink more. But no matter how much water you consume, you may still feel dry-mouthed or fatigued. This isn't ordinary thirst, it's your body reacting to serious imbalances caused by high blood sugar. Ignoring this sign could delay diagnosis and lead to worse complications. 3. Unexplained weight loss. Losing weight without trying might sound like a dream, but when it's unexplained, it can be a troubling sign of diabetes. Even if you're eating your usual amount or more, your body may not be able to use glucose properly due to a lack of insulin or insulin resistance. Since glucose isn't reaching your cells, your body starts burning fat and even muscle for energy instead. This results in rapid and unintentional weight loss. It's one of the clearest signs that something is wrong, especially in type 1 diabetes, and should never be ignored. 4. Increased hunger polyphagia. If you're constantly hungry, even shortly after eating a full meal, it might be more than just a fast metabolism. In diabetes, your body's cells aren't absorbing glucose efficiently, either because there's not enough insulin or your body isn't responding to it. This means your cells are starving for energy, and your brain keeps sending hunger signals. You may find yourself eating more frequently or in larger quantities, yet still feeling empty. This type of persistent hunger is a key warning sign that your body isn't processing sugar the way it should. 5. Fatigue and low energy. Feeling constantly tired, even after a good night's sleep, could signal more than just a busy lifestyle. In diabetes, your body struggles to move glucose from your bloodstream into your cells, where it's needed for energy. As a result, even though you're eating and your blood sugar might be high, your cells are essentially starving. This energy deficit can leave you feeling drained, sluggish, and mentally foggy throughout the day. Chronic fatigue is often overlooked, but it's a common and early sign of diabetes that deserves serious attention. 6. Blurred vision. Sudden or occasional blurry vision may not just be a sign of eye strain, it could be your body reacting to changes in blood sugar levels. When blood glucose is high, it can pull fluid from the lenses of your eyes, making it harder for them to focus. This may cause your vision to become distorted or blurry, and in some cases, it may come and go depending on your sugar levels. Left unmanaged, high blood sugar can lead to more permanent damage like diabetic retinopathy, so early visual changes should never be ignored. 7. Slow healing cuts and sores. If you notice that small cuts, scrapes, or bruises take a long time to heal, it could be a warning sign of diabetes. Elevated blood sugar levels can damage blood vessels and reduce circulation, especially to the extremities. This slows the delivery of oxygen and nutrients needed for tissue repair. At the same time, a weakened immune response makes it harder for the body to fight off infections. These factors combined mean even minor wounds can linger, worsen, or become infected, making this an important but often underestimated symptom. 8. Frequent infections. Recurring infections, like urinary tract infections, UTIs, yeast infections, gum infections, or skin conditions, may indicate your immune system is being suppressed by high blood sugar. Glucose not only fuels your body but can also feed harmful bacteria and yeast, making it easier for infections to develop and harder for your body to clear them. If you find yourself repeatedly battling these health issues, especially without a clear cause, it may be your body's way of signaling an underlying issue like diabetes. 9. Dark patches on the skin or acanthosis nigricans. If you notice dark, velvety patches of skin, commonly on the neck, armpits, groin, or knuckles, it could be more than a cosmetic issue. This condition, called acanthosis nigricans, is often an early sign of insulin resistance, where the body's cells become less responsive to insulin. As insulin levels rise, it can trigger skin cells to grow and darken abnormally. While not exclusive to diabetes, it's a significant clue that your body may be struggling to manage blood sugar effectively and should not be ignored. Before we continue with the last 3, if you're finding this information helpful, don't forget to subscribe and hit the like button. Now, let's continue. 10. Skin tags. Skin tags are small, soft growths that often appear on the neck, armpits, eyelids, or under the breasts. While generally harmless, an increase in their number can be a subtle but telling sign of insulin resistance, a precursor to type 2 diabetes. Insulin resistance may stimulate abnormal cell growth, leading to the development of these benign skin flaps. Because skin tags are common, they're often overlooked, but in the context of other symptoms, they can be a helpful indicator that your blood sugar metabolism might be out of balance. 11. Numbness or tingling in hands and feet. If you're experiencing a pins and needles sensation, numbness, or even burning pain in your hands or feet, it could be a sign of peripheral neuropathy. This condition develops when persistently high blood sugar levels damage the nerves, especially in the extremities where circulation is weaker. Over time, this nerve damage can become permanent if blood sugar isn't controlled. It's not just uncomfortable, it can also affect your balance, increase your risk of injuries, and signal that diabetes is already impacting your nervous system. 12. Dry, itchy skin. Persistent dry or itchy skin, particularly on the lower legs, can be a result of poor blood circulation and nerve damage, both of which are common complications of diabetes. High blood sugar affects the skin's ability to retain moisture and can reduce oil production, making the skin flaky and irritable. In some cases, itchiness may also be a reaction to fungal infections or eczema, which diabetics are more prone to due to a weakened immune system. While dryness may seem harmless, in diabetes, it's a symptom that shouldn't be brushed off. Recognizing these 12 signs isn't just about awareness, it's about taking action before the condition worsens. Diabetes can quietly affect nearly every part of the body, and these symptoms are your body's early warnings. If you've noticed any of these signs in yourself or someone close to you, don't ignore them. Early detection can make all the difference in managing or even reversing the impact. Your health is your most valuable asset. Listen to what your body is trying to tell you. For more easy-to-follow health videos like this, click this card. If this video helped and you'd like to support what we do, feel free to buy me a coffee, links in the pinned comment. Check the description below for more helpful tutorials. If you have a question or need more help, leave a comment, and I'll be happy to assist. Thank you for tuning in. Stay healthy, and see you in the next video.